And the QR code on your screen, we'll keep checking back in throughout the evening.
So just how dangerous is this drug, fentanyl? I've got a family here knows all too well. This is John and Jennifer Epstein in front of me here. They lost their son, Cal, back in 2020, as a matter of fact. He was home from college at the time, thought he was taking a pain medication. It was laced with fentanyl. So thank you for being here. Sorry for your loss, the two of you. John, tell me, if you can, because this was a good kid, and he certainly was not doing drugs at the time, was he?
Yeah, well, everyone we've lost is a good person. We like to tell our story not because we think Cal's life mattered more than anyone else's, but really just to make sure people know that it could happen to anyone. Cal was 18. He was home from his first semester at college, and he was supposed to go for a COVID test, and we noticed the car hadn't left. And so we went to check on him, and we found him unresponsive. We did the CPR. The paramedics came, first responders, and while that was happening, Jennifer found a small bag with a couple of blue pills in it. And the sheriff's deputy said, well, those look like oxycodone, but they're almost certainly fentanyl. And he added, if you're the praying type, you should start praying. So we went to the hospital, and we weren't able to bring Cal home. What is one of the things that we share with people is something we found later was the day before Cal purchased those pills online on Snapchat for just a few dollars. He went onto Google and he searched, what is an oxycodone? And how will it interact with my anxiety medicine? And what's a safe dose for my weight? And he received information about pharmaceutical oxycodone. That's what was sold to him, or what he was told he was buying. And he just really never stood a chance. It was 100% fentanyl.
Still trying to do his research before he actually purchased that. You have another perspective, Deb, over there.
Yes, Dr. Tom Jean from the Oregon Health Authority. You're the Deputy Health Director. Let's talk about the numbers of teens affected by death in fentanyl.
Yes, well, unfortunately, we are seeing a very significant increase. You know, in 2020, we had five kids under the age of 18 who died of a drug overdose in Oregon, and that nearly tripled to 14 in 2022, and we're on track for an even greater number this year. 12 of that 14 last year were fentanyl. So this is still a small portion of our total overdose deaths, about 1%, but any death is too many, and any death is tragic, as you heard with Cal and all these other kids.
And the quick increase in deaths as well.
Very rapid increase, just as we've seen fentanyl flooding, you know, the markets all over, but especially on the West Coast recently.
You talk about quickly it's happening. I want to show you a graphic right here, really bring this home for you right now. If we can bring this in the booth and show you this. Now, this is the drug overdose death increase from June of 22 to 23. Look at this. Number one in the country increase, Washington, 39%. Number two in the country, state of Oregon at 28%. Tony Vesna, I want to bring you in now, because how has fentanyl changed this whole drug crisis? Because clearly it has.
Yeah, so what I like to tell people is that, you know, fentanyl to heroin is kind of like crack was to cocaine. So, you know, we used to get heroin, and, you know, it was relatively expensive, and, you know, it would get you high for like 8 hours and it would wear off. And it was deadly in nature. And then now we have fentanyl, which is super cheap, super easy to make, super available. People smoke it, they get high really quickly, and then the high goes away really quickly. And there's the sort of physical dependence that happens to the opiates. So when you don't have any more, you need more to feel well. And then that was very similar to how crack was. The difference with fentanyl is that every time you use it could be your last, and you could die.
And there's a more powerful form that's coming out now, I heard.
Yeah, and then, you know, so now we're looking at carfentanil, which is extremely more potent, and it doesn't look like this is going to end anytime soon.
Yep.
Dr. Amanda Risser, I'm going to give you this mic so I'm not reaching in front. Let's continue that conversation about how it has changed the landscape. You're with Central City Concern and Hooper Detox Center. You're also a mom of teenagers. Yes. So as a parent, I have two teenagers myself. How do you talk to them about how this has changed the landscape of experimentation?
Oh, it's so hard, right? Because, you know, in every high school pretty much at Portland Public School, they've lost children to fentanyl overdoses. So it feels very relevant and really real. So when I talk to my kids about using drugs, I think it's important to let them know that I would prefer that they don't use drugs. I think it's safest and healthiest for kids to wait and to, maybe minimize their drug use. I don't think any amount is healthy. And I also acknowledge and really get honest with them about the fact that they probably will use drugs or their friends will use drugs. And then we talk a lot about, how to use safely, information about how fentanyl has really penetrated the drug supply and how situations like Cal's parents experienced can happen, where somebody thinks they're using one substance, but they're using fentanyl, and it can make them stop breathing and die. I also talk about, we just double down on safety, and our expectation is that, they know what they need to know to keep themselves and their friends safe. We make Narcan available to them and encourage them to take it with them when they are going about their business, living their lives, and we've taught them how to use it and encourage them to teach their friends how to use it. So those are kind of the basics. And, just in terms of my professional life, I've really I've been taking care of folks with opioid use disorder since I started residency in 2003. And in the last 4 or 5 years, it's just been incredibly different and much, much, much more challenging. We've had to innovate really quickly. We've had to try as best we can to expand services. And this all coincided with our pandemic, where folks were isolated and services were shutting down and access was really decreasing. And so I think that's the challenge that we all have as professionals who take care of folks who have substance use disorders, in trying to adapt as quickly we can to this very rapidly changing landscape.
Thank you.
So why do kids turn to drugs? It's the age-old question, right? Well, we had talked to several young people going through addiction recovery. Here's what one of them had to say. Watch this.
When my grandpa passed away, he was like the closest person to me, and it just really hurt to see him gone. So I started to use to kind of like cope with that, like feelings of anger and upset, like sadness.
It was just to numb myself, anything to get rid of the kind of feeling of worthlessness. So I started doing like Percocets, which I eventually got laced, and I started doing fentanyl. And I knew it was fentanyl, so at a certain point I was just buying like bags of just pure fent, just smoking fent.
We have here Marissa and Harlow, both peer mentors, and you both going through recovery yourself to this day. You watch that. What are some of the other reasons that kids turn to drugs these days, Marissa?
Teenagers nowadays use drugs to cope with intense feelings. It's another way of coping because the teenagers don't know how to cope and aren't given the right tools to cope with intense feelings, mood, traumas that are going on in their life. And so they turn to drugs. Other reasons is also like it's available, it's talked about. And so a lot of these teenagers don't have the right tools or the right support and help that is needed, and so that's where they go, to drugs.
Dr. Franz, I want to ask you a question. If I can step back in front of the camera here, my apologies. What should parents be looking out for right now? Because they hear the story about these folks getting into the drugs at a young age, but as a parent, if you're at home, what should I be looking out for when it comes to using these drugs?
Sure. Well, one of the scary things about fentanyl is that it doesn't take much experimentation to use it. So I think even before we talk about what they need to look out for is just universal education in the family home about the risks of fentanyl and that it's on the streets. And the DEA now has a public campaign that I think is a good one, that is one pill can kill. And this is real. I mean, this isn't just to get you scared straight. This is the truth. And our teenagers, our young people need to know that when they get that pill off the street, more than likely it's going to have fentanyl. And especially if you're naive to it, it really literally can kill you in one try.
Once we get that educational campaign out to our kids at home, then if you are noticing things like a change in routine, some seclusion, some changes in academic performance, mood, these are things that would be concerning, and you might want to talk to your child about it, use open-ended questions, be not really confrontational or punitive, but just try to understand what's going on to see if there is an issue and be available to help them.
Because the key is really not to ignore it, but talk to them.
Exactly.
Right?
Be present.
Be present. Dr. Franz, thank you. Deb?
Very important conversation. We will continue after this break. We're going to look into how can we stop drug use when we come back.
It happened so much faster than I expected, because at first I was just doing like weed and everything, and then it just kept getting more and more intense because things kept being offered and I kept being like, I just need more and more and more, and it was just a nonstop cycle.
Welcome back. I want to introduce you now to Sharon Purse-Martin and Todd Nicholson. They are two principals of the only two recovery high schools in the state of Oregon, and they're fairly new. Harmony started in 2019 and Rivercrest just started in the fall. And let's start with you and talking about the difference of how fentanyl impacts a teenager versus an adult and what you see in the school.
Yeah, so we're dealing with a really special group of young people. So they're part of the 40,000 or so adolescents in Oregon that have substance use disorder. So they've gone past the stage of experimentation. And fentanyl has been sort of a risk to them the entire time. I share an anecdote about a student on their interview who told me that they were being safe using meth and that they overdosed accidentally on fentanyl trying to be safe. And so it's really changed the way that they're trying to take care of themselves and the way that they try to take care of each other.
Todd, let's talk about your new school, Rivercrest. You just opened in the fall, and
Yes.
how accessible is it to kids?
Yeah, so we are in Multnomah County, and I work for the Multnomah County, or the Multnomah Education Service District, and we serve all 8 school districts in Multnomah County. The way that the current funding model for that is at this point is that the student's resident district needs to approve the placement and be able to fund the placement. Now that's all going to change in the very near future. Our funding will come come from the state. But so now usually what happens is parents or youth themselves will reach out to us. And at that point, then we will help advocate and figure out how they can get to us. All we require is a desire for the student to want to be abstinent and to stay abstinent. And to that end, we write individual programs of recovery for these students and provide them the support that they need to stay clean and sober.
And you also provide Narcan on campus as well.
We absolutely do. In fact, next week we'll be training all of our youth and providing Narcan for them to have, because they are in these circles. They are out there where this is happening. And it's actually been a little bit of a stretch for me, just as a school administrator, you know, on the surface to provide medication for students, you know, just in case. But really, I think the fentanyl crisis is such that it completely makes sense.
Sharon, you wanted to add something?
Yeah, so I did a survey of our students recently, and 1 in 5 of them had actually actively reversed an overdose. These are 15-year-olds and 16-year-olds getting to be part of the solution now that they're in recovery. But on the darker side of that, 62% said they'd lost a loved one to an overdose.
I was just going to add that 100% of my students have experience with a fentanyl overdose, either themselves, several of them, or certainly their peers. And that is an ongoing thing. So in addition to providing recovery support, we're also having to support students with grief and loss and that sort of thing on a daily basis. I'm sure the other providers here can tell you that we know when there's a particularly bad batch in town or a particularly potent batch, because it really ramps up.
Thank you so much.
So what are the school districts doing to educate these kids about the dangers of fentanyl? I want to bring in Jen Hicks now from the Beaverton School District. You guys are trailblazers of sorts. We talk about the Fake and Fatal program in your district, in your school. Tell me about that.
In the 2020-21 school year, we very tragically lost a handful of students. And as a result, we came together and thought, what can we do to prevent this from happening further? And we were very fortunate to be able to work with the Epstein family to help guide us through that process. And we really wanted it to be a community effort where not only did we want to educate our students and staff, but we wanted to educate parents and the community as a whole to make sure that the reality of what fentanyl was really understood. Because even at that point, I have to be honest, my knowledge of it was minimal. Mm-hmm. And working with the Epstein's, the Song for Charlie organization, we were able to put together specific lessons that were taught in all of our middle school health classrooms, in our health 1 and 2 curriculums in the high school. But then we knew we needed to get all kids at the secondary level. So we incorporated it into our advisory lessons as well, which then allowed every student within the secondary curricular area in Beaverton to get these lessons. So we were serving over 20,000 kids.
You've had successes since implementing this program. Tell me about that.
Since March of 2021, we have not had any reported student deaths due to fentanyl. We have been able to work with other districts and spread this message around the country. It's been a rewarding in that sense, but you know, it came out of something so deeply tragic and personal, but we wanted it to feel that way. And part of our lesson does incorporate the Epstein family sharing their story and their son Miles sharing his experience, which has been so powerful for our kids to hear from another person their age and what that experience was. it's still a work in progress, but we continue to move forward and keep this curriculum engaging and meaningful and updated because the information keeps changing.
In fact, you worked with the Epsteins on this program, and I want to bring Jennifer Epstein into the conversation here. And Jennifer, when you watch this whole program unfold and the successes they've had, what do you think when you see this happening in the Beaverton School District?
Yeah, it's bittersweet. As you heard from John, Cal was trying to be safe. He Googled looking for what oxycodone was and how it would react with his medicine, etc. And so I believe that if he had this information, excuse me, he'd be here today. And so I'm so grateful that we can be a part of the solution. I'm grateful that Beaverton School District was willing to take action. A lot of school districts across the country were dealing with COVID at the time. Fentanyl was an unknown. They didn't understand. And Beaverton really took a risk by developing a program around this so early in the crisis. And so I'm really grateful that we can be a part of it, but it certainly is bittersweet.
We need more school districts jump aboard
Yes.
and do the same. Deb?
Let's talk about what the state's responsibility is in this crisis. Sarah Gelser-Bluen joins us, state rep, and should the schools be mandated to impart programs like we just heard?
Thank you so much. Schools are such a critical part of kids' lives. That is one of the common factors that all kids have. So if we want to look at places where it is effective, where there are people that they trust, where they can hear from peers, schools absolutely are the place to start. They are the solution. The other thing that we need to do is make sure that when kids get that information or recognize that they're in danger and recognize that they need help, we have to make that help available immediately when they are ready to receive it. By the time you wait a week or 2 weeks for a referral, it's too late. It's if a kid says, I need help now, it needs to be now, and that's why we need to act to make that possible.
Thank you. And State Senator, sorry. All right, thank you.
And Dr. Franz, in your background, behavioral health, I'm going to slip around here. Do these programs that we're talking about right now, do they work?
They do work, absolutely. They work at various levels for more mild conditions. Outpatient treatment can be very effective. For more severe conditions, you need higher levels of care, intensive outpatient, partial hospitalization, residential, or in some cases, medical detox programs. We've heard how potent fentanyl can be and how quickly kids can get addicted to it, and you need to have programs that can treat that medically. Perhaps most importantly, we have something called medication-assisted treatment now, which includes buprenorphine and primarily is what's available to kids, and it's FDA indicated above the age of 16 and can even be used below that age, and it's an effective medication for opioid use disorder. And in fact, I'm a medical director at our health plan regions, and we require our providers that have higher levels of care to offer medication-assisted treatment to our members if we're going to have them contracted.
Take a quick break. What resources are available out there for you folks? You're thinking about your kids? Come back after the break. More after this. You are watching KATU's Recover Northwest Town Hall, the new drug crisis. We're talking about the very dangerous drug fentanyl. What can you do about it? How do you talk to your kids about it? And what resources are available out there for you? We're going to answer all those questions. More folks will be talking coming up after the break.
Talk to your kids about what they need. Talk to them about how you can help them before the drugs even start. And when it does start, ask how they can help. Because given a choice, people won't want to be addicted.
I feel like if I had known like how negatively it would have impacted my family and my friends, I feel like I wouldn't have started using.
We're continuing the conversation tonight. I want to talk to Representative Lisa Reynolds, also 20-year pediatrician. Is there a way to screen for high-risk behavior at all?
Well, I mean, part of being an adolescent is high-risk behavior, sadly. So it's really important to have that conversation with every teen. But I think it is important to screen for who's at risk for addiction. And we know that addiction can run in families. We've also really learned, I know the conversation is not about marijuana today, but we certainly have learned that the rapid increase in marijuana use among adolescents is truly a risk factor for future opioid experimentation and addiction. So I think those things should all be red flags.
So we shouldn't ignore the marijuana use or the alcohol use with teens as
Absolutely not. No, that's probably a story for another day, but it ties in here very importantly.
Okay, let's talk, Dr. Jean, let's continue that conversation. Are there signs to watch out for?
You mean with regard to
with those kind of gateway drugs, I guess, if you talk about.
Yeah, well, I think the bottom line that we've already hit is so important to understand that any pill that's on the street could have a lethal dose of fentanyl. But that said, you know, we do have concerns about any substance, including cannabis, use by underage people. There are impacts to development, learning, memory, mental health. So there are real concerns with any of these substances. And often the cases, somebody will start with something pretty tame, and before they know it, they're dependent on something that's a lot more serious.
Is there a best way to talk to your kids about drugs? That's the big question. And John Thornton, I want to bring you in now. Madrona Recovery, your clients 13 to 17 years old, that's a prime age. We know that. What is the best way these parents should be talking to their kids?
Actually, I have two daughters. One is 10, the other is 13. In preparing for this, I asked them, and they knew very little. And when you hear the stories of people losing, when I work with the kids in our program, and they are kind of oblivious in advance of the use, that is scary. And so we need to start talking to our kids immediately. Open, honest conversations, sharing stories, having mentors who have gone through those experiences, getting them into classrooms, into our programs. And really those are powerful moments when people who've experienced them, those things directly, can share them out. Those voices matter.
Any other thoughts on this side of the room on how parents should talk to their kids? Let's go down here to Jennifer. Yes.
I think that parents need to have continuing conversations. This is not a one-time conversation. We've done surveys where we asked parents how many parents had talked to their kids about misuse of pills. 75% of the parents had said that they had had those conversations. On the flip side, only 25% of the kids we surveyed said that their parents talked to them about it. So some parents may think they're talking about it, but maybe the message isn't getting through. Maybe the kid was distracted. Maybe it wasn't a long enough conversation. So it needs to be an ongoing conversation. And I think at an age-appropriate level, it can start very early. Whenever you have an elementary school student, you could talk to them about prescription pill use and show them that you have a prescription and you only take a prescription that was prescribed to you by a doctor. You know, it doesn't have to necessarily be a fentanyl conversation, but you can have those types of conversations. And as the kids get older, you know, recognize that they're always watching you. So, you know, if you come home stressed for the day, think about the behaviors that you're displaying, how you handle your stress, and what example you're setting for them, and you know, have conversations about what are healthy ways to deal with stress and what are not healthy ways of dealing with stress. So I think it's an ongoing thing. We at Song for Charlie have developed some tools. We have a new platform called the New Drug Talk, and it was developed for we developed in conjunction with the California Department of Healthcare Services, and it is a tool that is made for parents and caregivers to help them to understand the fentanyl crisis, what is going on, and give them tools to have conversations with their kids, because it is hard, it is awkward. Parents don't always know what to say, and so we're trying to provide information to parents to help them.
It's not something you think about when you have a child, is how am I going to talk to them about drugs someday, until it gets to that point where you really have to talk to them. I'm going to slip in front again, and Dr. Franz, what can you add to this?
Yeah, I want to emphasize the developmentally appropriate conversation, and that it's really never too young, as long as you do it in a developmentally appropriate way. So that was great advice. And also, there's a technique I'm sure many people have heard about called motivational interviewing. It can be used for a variety of situations, but it's really good when talking with adolescents about their substance use. And an acronym that I like to remember, and it's easy, is OARS. So you ask some open-ended questions. So, you know, what's up? How's it going? And when you hear back from your child or adolescent, you affirm what they're saying. You just say, wow, okay, that's going on. That must be really real. And then you reflect back on them, and then you summarize what they've told you. So it lets them know that you've really heard them, and that you're not telling them what to do, or you're judging them, or you're punishing them. And once you start down that road, additional conversations can come from that.
Yep.
Dr. Risser, I want to talk about how much naloxone you have on hand at Central City Concern, and also talking about the potency. I think the conversation has changed so much. When we first started really bringing fentanyl to the forefront, it was about a grain of sand could kill you, and now you see pills, and what they're learning from that message.
Well, I mean, I think the question of tolerance and the physiology of fentanyl use is really interesting and really difficult. So what we're talking about here are children who might be experimenting or trying out a substance, or maybe using something that they think is one thing and it's actually fentanyl. And children who have never been exposed to opioids, well, any human that's never been exposed to opioids, when exposed to highly potent synthetic opioid, that can be very dangerous. We're also hearing from children, and we know that children are in our community that know they're using fentanyl and are using it regularly. They're also at risk, but their physiology is quite different in that they have developed tolerance and use a fair amount. You know, some of my patients, my adult patients, are using fentanyl every hour that they're awake. Wow. And that can be, 20 or 30 pills a day, whereas somebody who's never been exposed to opioids could, unfortunately die from a very small amount. So I think that we're it can get kind of confusing when you're talking to children about these substances, and they might, know about people who are using a large amount, but those bodies are really different. Their nervous systems are really different than somebody who's never used that substance or uses it only very rarely. Everybody who uses fentanyl is at risk for overdose death, and folks who have never been exposed to opioids before or rarely are at very high risk for death. And in terms of naloxone, we believe at Central City Concern that access to naloxone is life-saving, and we generally distribute it or prescribe it in the intranasal form because it's so easy to administer. It doesn't require anybody to know how to inject a substance or a medication, and I carry it all the time. I am part of reversing overdoses multiple times a year, and it's effective. I think there are concerns that maybe Narcan is not effective for fentanyl, and Narcan is still a very effective treatment for overdose.
Well, let's go on that. I'd like Dr. Jean to weigh in on this and how important that is to have in schools.
Yes, so just today we announced that Save Lives Oregon, our harm reduction clearinghouse, is distributing free naloxone or free opioid reversal kits to every middle school and high school in Oregon. So these are kits that include naloxone, which is the opioid reversal agent. It's a drug that's harmless to use, but can save lives. And so these kits have several doses of that naloxone. They also have instructions and emergency medical supplies. We've already had more than 500 schools in Oregon request these, so
Great.
That's a wonderful thing.
Thank you.
We have talked about the problem. Now, what are the resources available out there? We're going to talk about that when we come back. Welcome back. It's important we have a town hall like this to talk about resources that are available, because people at home want to know, what can I do if I have a child that's going through something like this? Problem is, when I'm hearing from some of these folks, there aren't enough resources out there. I want to bring Tony Vesna back in. Tell me about that, Tony.
Yeah, and unfortunately here in Oregon, we have a very underfunded system, and it's been like that for a very long time. And so for adolescents, we're talking about, we have thousands of adolescents who need help, who can't access it. We have about 40 residential treatment beds across the state, very little detox, and then one youth and family recovery center at 4D. And so 4D is pushing legislation this session, asking our elected leadership to invest about $20 million, $10 million into prevention, $10 million into treatment services, and then leverage the Alcohol and Drug Policy Commission, which is a group of experts across the spectrum of prevention, treatment, recovery services, to develop a plan to address the shortcomings in adolescent services, because we don't want people who are reaching out for services not to get them. And the fact is that right now, there are no resources, and the problem's growing exponentially.
Because even what you talk about now is going to take a while to unfold, right? So somebody going through this right now is going to wait a while, right?
Yeah, they are. Unfortunately, they will have to wait. And we see that a lot at our adolescent program. And I think one of our mentors, Harlow, could talk a little bit more about that with some of the kids and families that she works with.
Well, let me go back here to Harlow and let's talk about this. Some of the folks you work with, Harlow, you and I were talking about this earlier. You do believe that more needs to happen when it comes to resources. Tell me about that.
Yeah, we have clients that need detox services, need inpatient treatment, and have no options in state for that. The only options that our clients have is either mental health treatment, which sometimes helps, but is not substance use specific. And so clients that need substance use specific treatment are having to go out of state for that. And the clients, and families that can't afford that aren't able to, provide those services and get their kids where they need to go. And yeah, it's just, things we need to catch up on as a state.
Yeah, so frustrating. We have to go out of state to get the services you need.
I know State Senator Sarah Gelser-Bluen is eager to jump in on this conversation, what the state's trying to do.
Thank you. So in February, we are introducing legislation that would do exactly what you're talking about. We need more services, we need more funding, and we need to stop sending families running in circles. It is devastating that so many families either have to send their kids away to other states or release them to the state just to get care. So what this plan would do is allow all kids who have an addiction or a mental health issue to be eligible for Medicaid services regardless of their parental income. We will bring them in and access our new EPSTD program, which basically is a federal program that says we screen and treat everything a child needs. It will have in-home support services for families and kids that are at risk of out-of-home placement, and the federal government will pay $7 for every $3 that we put in.
How confident are you that this could pass?
I feel very confident that this could pass. It will cost us about $2 million to put it together. It will save lives, it will keep families together, and it will prevent on the front end a lot of the suffering that we see unfolding on our streets. Because if we can support kids and families when they're young, so kids know how to advocate and take care of themselves and live as a person with a mental health issue or in recovery, and support families so they don't burn out and kind of get punished and shamed into a corner away from their kids, they're not going to succeed. But if we do it the right way, we can.
Any thoughts?
Yeah, excellent work from Senator Gelser-Bluen. As a general pediatrician, I deal with a lot of young people with mental health struggles. And I will say most of them respond really well to treatment and to therapy. And I think we've done a great job as a state and as personally in my clinic of trying to shepherd kids into those services, hopefully before they develop an addiction. I also think we need to do even further upstream. We talk about middle school curriculum. I'm talking about ending child poverty. If we could really reduce some of the toxic stresses that set a child up for a life full of more difficult struggles than they otherwise might have, like this would be cost effective and it's morally the right thing to do.
Thank you.
Thank you.
John Thornton, you've been listening to this. Listen to Senator Bluen over here. Give me your thoughts. Does it give you hope?
Does, and actually, so we at Madrona are doing residential secure detox withdrawal management. We do the MAT, and today we have 27 kids on our waiting list that are in hospitals, have gone through overdose, that are looking to get that immediate help, and they're not getting it quick enough by any means. We are increasing our bed count. That came from a direct investment from Oregon Health Authority, Oregon DHS, that have recognized the need, and this is one of many things that need to help. But access to beds, access to medical assisted treatment is huge. We then need to be able to send kids into outpatient services, to the 4Ds, to the Harmony Academies, Rivercrest. We need to really integrate all these programs and ideas, and it has to happen so quickly. We're unfortunately caught up in a trend that is going in the wrong direction, and we need to act as quickly as we can. And I'm glad for this opportunity to share that need for that curriculum, for that continuum of care. It just needs to happen as fast as possible. Thank you.
Dr. Franz, you hear the frustration from some of these folks saying resources just aren't there, and it's going to be a while before they get there. We hear from the senator that they're somewhere, hopefully, down the road. Give me your thoughts as you listen to this.
I agree 100%. We just do not have enough providers to meet the need, and it takes everyone working together to try to figure that out. I appreciate our policymakers' efforts. I really appreciate our provider partners' efforts. We at health plans also need to take this very seriously and do anything we can to try to make sure we're contracting with quality providers. The problem is we don't have a workforce that is fully developed to meet that need, and we're actually starting at that place of how do we develop a workforce. And it's even worse on the substance use disorder side than the mental health side, which, you know, we've added hundreds of behavioral health providers in Oregon alone in the last 2 years to our plan, but the vast majority of that's been on the mental health side. That's still not enough. Finding medication-assisted treatment for kids is extremely hard. Madrona, maybe a couple programs in the Portland area. Otherwise, you're looking at, you know, some primary care providers who've decided to do medication-assisted treatment. Those folks are mostly treating adults. So once you get to the kids' age, we've really got to develop that expertise. I know from talking, I consulted to the 2 largest primary care clinics in Central Oregon, and I know that when primary care physicians do medication-assisted treatment, they say it is the most satisfying work they've ever done. So I think there's a role for this in primary care as well.
Any quick comments? Got about a minute left before we go to break. Yes, let me step in front of you.
I heard somewhere, I'm going to paraphrase this probably badly, but you can take the measure of a community by how it takes care of its children. And I think that's completely right. You know, if you look at the bell curve of who we're losing to overdose, it's mostly in the middle, right? It's 30 to 50-year-olds. Over the last 5 years, we've lost 4,000 people in Oregon, and 300 of them were under the age of 25. But if we don't focus on the younger age, the upstream work of prevention and younger age treatment, which is very effective if you're able to do it, then we're going to be continuously in the situation that we're in. So we have to figure out a way to do both. I know that's easier said than done, but we really have to focus on the youth in our state.
And that's why it's important you folks are here today to get the word out, right? So we can make things happen like you have. We're going to take a break. Come back after this.
Welcome back. As we are in our final time here, I want to introduce you to Renee Valoria, and you struggled for years trying to get resources for your son, but you want to touch on the real strong relationship between mental health and addiction.
Right. There's actually two things. I just wanted to say I'm glad, Senator, that you addressed one of my concerns was about people that don't have a lot of money and getting their children into treatment. And it's nice to know that once that is being addressed in a bigger way, that you're talking about Medicaid eligibility for those children. That's wonderful. But the other thing I did want to bring up, because I kind of keep hearing the situation being talked about in separate ways as mental health and as addiction, but my son, who has been an addict for 18 years, those pieces were together from day one, and the only time he had any kind of success was he was in a program that addressed them both, and it was inpatient initially, and that was the one time he did really, really well.
Thank you.
Yeah.
I want to give the last word to the Epsteins, who tragically lost their son to fentanyl. And I know, Jennifer, you had a message you wanted to give before we go.
Yeah, you know, first of all, I just want to acknowledge that everybody here, you know, talked about a little component of the crisis and what they're doing to solve it. And so you can see that it's a very complex crisis. It is a crisis that has been years in the making, and it is going to take years to fix. It's not something that's going to fix where anybody's going to be able to fix it overnight. And so I want to let parents know that, you know, what you can do is talk to your kids. I think any parent who thinks that their kid is immune from this problem is making a mistake.
And that's the key, is to get the word out and just open that discussion. Thank you for watching, folks. Good night.
This Recover Northwest special was sponsored by Regions Blue Cross Blue Shield of Oregon.